Antisocial personality disorder, or ASPD, is a serious mental health condition. People with ASPD often disregard rules and the rights of others. They may lie, manipulate, and engage in reckless behavior. This can cause significant problems in their relationships, work, and life in general. ASPD is a long-term pattern of behavior. It is not simply a phase a person goes through. DSM-5-TR outlines specific criteria for diagnosing ASPD. These criteria include a pervasive pattern of disregard for and violation of the rights of others, occurring since age 15 years. ASPD manifests through various behavioral patterns. Individuals with this disorder often display a blatant disregard for social norms and the rights of others. They may engage in deceitfulness, repeatedly lying, conning others, or using aliases for personal gain or pleasure. Impulsivity is another hallmark of ASPD. Individuals may act without thinking of the consequences, leading to frequent job changes, financial instability, or legal troubles. They might also exhibit irritability and aggressiveness, often engaging in physical fights or assaults. A lack of remorse is a chilling characteristic of ASPD. Individuals may show indifference or rationalize hurting, mistreating, or stealing from others. They fail to learn from their mistakes and continue to engage in risky and destructive behavior. The exact causes of ASPD remain unclear, but research suggests a complex interplay of genetic predispositions and environmental factors. Some studies indicate a genetic component, with individuals with a family history of ASPD or other personality disorders being at a higher risk. Early childhood experiences also play a crucial role in the development of ASPD. Trauma, neglect, or abuse during childhood can significantly increase the likelihood of developing the disorder later in life. Additionally, inconsistent parenting styles, exposure to violence, or having a parent with a substance abuse disorder can contribute to the development of ASPD. ASPD has profound and often devastating consequences for both individuals diagnosed with the disorder and society as a whole. Relationships are particularly vulnerable, as individuals with ASPD struggle with empathy, intimacy, and maintaining healthy connections. They may engage in abusive behavior towards partners, family members, or friends. Professionally, individuals with ASPD may struggle to maintain employment due to their impulsivity, unreliability, and disregard for rules. They might engage in theft, fraud, or other criminal activities, leading to legal repercussions and further social isolation. Society bears the brunt of ASPD through increased crime rates, strained social services, and a heightened sense of fear and insecurity. The economic burden of ASPD is significant, encompassing healthcare costs, legal expenses, and lost productivity. Navigating treatment for antisocial personality disorder poses significant challenges due to the inherent difficulties in engaging individuals. However, treatment is not impossible. Therapy remains the cornerstone of ASPD treatment. Cognitive behavioral therapy, or CBT, helps modify distorted thoughts and beliefs. It equips them with coping mechanisms for anger and impulsivity. Schema therapy delves into early childhood experiences and maladaptive schemas. It fosters healthier emotional regulation and relationships. Living with ASPD presents individuals with numerous challenges that impact various aspects of their lives. Maintaining stable relationships can be particularly difficult, as their behavior patterns often lead to conflict, distrust, and broken connections. Managing impulsivity and anger poses another significant hurdle. Individuals with ASPD may struggle to control their urges, leading to reckless decisions, substance abuse, or aggressive outbursts. This can result in legal troubles, financial instability, or jeopardized relationships. Coping with ASPD involves a conscious effort to recognize triggers, develop self-awareness, and implement healthy coping mechanisms. Learning to identify and challenge negative thought patterns is crucial, as is finding constructive outlets for anger and frustration. Supporting individuals with ASPD requires patience, understanding, and a non-judgmental approach. Family and friends play a vital role in encouraging treatment adherence and providing emotional support. Educating oneself about ASPD is crucial for fostering empathy and understanding. Recognizing that ASPD is a mental health condition, not a choice, can help loved ones provide support without enabling or condoning harmful behaviors. Setting healthy boundaries is essential for both the individual with ASPD and their support system. This involves clearly communicating expectations, consequences for crossing boundaries, and prioritizing self-care to avoid burnout. ASPD and the criminal justice system. ASPD often intersects with the criminal justice system due to criminal behavior. This can range from petty theft to serious offenses like assault or fraud. The relationship between ASPD and criminality is complex. Not all with ASPD engage in crime, and not all criminals have ASPD. Addressing ASPD requires a multi-pronged approach. This includes mental health services and rehabilitative programs. Community support upon release reduces recidivism. A brighter future hope and advancements in ASPD treatment. Despite the challenges posed by ASPD, there is hope. Advancements in research are paving the way for more effective treatments. Early intervention is crucial. Novel therapies like transcranial magnetic stimulation offer promise. With deeper understanding comes hope for a brighter future.